Good evening, viewers. Welcome to your number one health show, Healthzone on Bina TV. Our topic for discussion this evening is dysmenorrhea. One may ask, what is dysmenorrhea? Dysmenorrhea is the medical term for painful menstrual periods which are caused by uterine contractions. In other words, menstrual cramps. So there is primary dysmenorrhea and there is secondary dysmenorrhea. Primary dysmenorrhea refers to recurrent pain, while secondary dysmenorrhea results from reproductive system disorders. Both can be treated. So most of the time with the secondary dysmenorrhea, there is an underlying cause which is causing the pain other than the normal menstrual cramps we know. So primary dysmenorrhea is the name for common menstrual cramps that comes back over and over again, recurrent, and aren't due to other diseases. The pain usually begins 1 or 2 days before you get your period or when the bleeding actually starts. You may feel pain ranging from mild to severe in the lower abdomen, your back, or your thighs. Pain can typically last 12 to 72 hours, and you might have other symptoms such as nausea and vomiting, fatigue, and even diarrhea. That is with the primary dysmenorrhea. So common menstrual cramps may become less painful as you get older and may even stop entirely if you have a baby. If you have painful periods because of a disorder or an infection in your female reproductive organ, it is called secondary dysmenorrhea. Pain from secondary dysmenorrhea usually begins earlier in the menstrual cycle and lasts longer than common menstrual cramps. You usually don't have nausea, vomiting, fatigue, or diarrhea. So whilst primary dysmenorrhea comes with nausea, vomiting, fatigue, and diarrhea, and some pain in the abdomen, the back, and the thighs, secondary dysmenorrhea comes with a lot more pain, and the pain doesn't ease. And it is normally associated with other conditions, other underlying conditions. So menstrual cramps happen when a chemical called prostaglandin makes the uterus contract, that is, tighten up. The uterus, the muscular organ where a baby grows, contracts throughout your menstrual cycle. So during menstruation, the uterus contracts more strongly. If the uterus contracts too strongly, it can press against nearby blood vessels, cutting off the supply of oxygen to the muscle tissue. You feel pain when part of the muscle briefly loses its supply of oxygen. So how does secondary dysmenorrhea cause menstrual cramps? So we look at that now. Menstrual pain from secondary dysmenorrhea is a result of problems with the reproductive organs. Like I said, with secondary dysmenorrhea, there is always an underlying cause. So not all the menstrual cramps are normal. That's what we are trying to say here. Menstrual pain from secondary dysmenorrhea is a result of problems with the reproductive organs. Conditions that can cause cramping include endometriosis, adenomyosis, pelvic inflammatory disease, and fibroids, which are benign tumors. So when we take endometriosis, there will be a time we'll take each of these conditions one after the other so that we go through them and get a better understanding. But these are the conditions that can cause secondary dysmenorrhea. So endometriosis is a condition in which the tissue lining the uterus, that is the endometrium, is found outside of the uterus. Because these pieces of tissue bleed during your period, they can cause swelling, scarring, and pain. Another thing that can cause secondary dysmenorrhea is adenomyosis. It is a condition where the lining of the uterus grows into the muscle of the uterus. This condition can cause the uterus to get much bigger than it should be, along with abnormal bleeding and pain. Then we come to pelvic inflammatory disease. So this is an infection caused by bacteria that starts in the uterus and can spread to other reproductive organs. PID, as it is commonly known, can cause pain in the stomach or pain during sex. That there is cervical stenosis, which is narrowing of the cervix or the opening to the uterus. Then finally we come to fibroids. Fibroids can also be a contributory factor to secondary dysmenorrhea. Like I keep saying, it is not all the menstrual cramps that are normal. Some of them are secondary and they are a cause of an underlying condition. Another cause of this condition would be fibroids, which are growth on the inside or outside or in the walls of the uterus. Yeah, abnormal growths, of course. These go a long way to cause secondary dysmenorrhea. So, what are the symptoms of menstrual cramps? If you have painful periods, you may have aching pain in the abdomen. Pain may be severe at times, yeah. The feeling of pressure in the abdomen. There is pain in the hips, lower back, and inner thighs. I know a lot of women can relate to this. So then now we come to this question. How can you tell if the pain of your menstrual cramps is normal? Because right now we are trying to say not all the pain that comes with menstrual cramps is normal. Some happens to be abnormal, and they come in two forms, the primary and the secondary. So how do you know if the pain of your menstrual cramps is normal? If you have severe or unusual menstrual cramps that last for more than 2 or 3 days, contact your healthcare provider. Because with primary dysmenorrhea, after the few days, the first few days, the first, second, third day, the pain begins to ease. So if the pain is still consistent after 2 or 3 days, you have to contact the healthcare provider. There may probably be an underlying cause. Both primary and secondary menstrual cramps can be treated. So it's important to get checked. First, you'll be asked to describe your symptoms and menstrual cycles. Your healthcare provider will also perform a pelvic exam. During this exam, your provider inserts a speculum, which is an instrument that lets the provider see inside the vagina. The provider is able to examine your vagina, your cervix, and your uterus at the same time. The doctor will feel for any lumps or changes. They may take a small sample of vaginal fluid for testing. If you use tampons and develop the following symptoms, I hope we all know what tampons are. Those who don't know what they are, I don't know how to describe it. Okay, so the tampon will be shown on the screen, those who don't know what tampons are. So if you use these kind of tampons, I'm coming. So if you use tampons and you develop the following symptoms, get medical help right away. Fever, so if you use tampons and you start getting fever during your menses, you are vomiting, you have diarrhea, there is dizziness, fainting or near fainting, and then a rash that looks like a sunburn. These are symptoms of toxic shock syndrome, a life-threatening illness. So how can you relieve mild menstrual cramps? To relieve mild menstrual cramps, for the best relief, take ibuprofen. Yes, it's anti-inflammatory as soon as bleeding or cramp starts. Ibuprofen belongs to a class of drugs called non-steroidal anti-inflammatory drugs, commonly known as NSAIDs. They reduce the output of prostaglandins. If you can't take NSAIDs, you can take another pain reliever like acetaminophen. That is our common paracetamol. Place a heating pad or hot water bottle on your lower back or your abdomen. You have to rest when needed. Avoid foods that contain caffeine. It will not help. Then you avoid smoking and drinking alcohol. In addition to that, massage your lower back and abdomen. Women who exercise regularly often have less menstrual pain. To help prevent cramps, make exercise a part of your weekly routine. If these steps don't relieve your pain, your healthcare provider can order medications. The steps doesn't relieve your pain, your healthcare provider can order other medications including ibuprofen, or another anti-inflammatory medication in a higher dose that is available over the counter. Your healthcare provider might also suggest oral contraceptives, since women who take oral contraceptives tend to have less menstrual pain. But like we said, with all this, you have to see your healthcare provider to be properly taken care of, and then they will decide which way to go with your pain. If testing shows that you have a secondary dysmenorrhea, your provider will discuss treatments of the condition causing the pain. This might mean oral contraceptives, other types of medications, or even surgery in some cases. So what types of alternative therapies might help with menstrual cramp? Women who have painful periods often try to find natural ways of dealing with the pain. Studies on alternative or complementary methods have not been conclusive about So jama'a assalamu alaikum, ni ne naku Wattigi. Da murancin gafiran mu ne kan dysmenorrhea ne. Bi ma'ana painful menstruation in kana haila, ciwon haila. No matter the one I experience ciwon mara na baya da bayan katara inda suna haila. To cikin firan mu mun zo mun ga kaman akwai normal one. Normal ne mace ta zo tana haila tana samun pain, ba so da yawa an raba shi cikin kashi biyu ne. Akwai primary dysmenorrhea sannan kuma akwai secondary dysmenorrhea. Primary nan shine normal one da muke samu, mace ta zo tana haila ta zo tana samun pain shi so da yawa first day ranar farko rana biyu zuwa rana uku dai she wannan pain ya zo kasa, ciwon ya zo kasa, she ya zo ya sake, she ka zo ka samu kanka dai har zai ya zo ya kare. Wani bi yana bar yana ma kaman za ka yi amai, wani bi ma yana bar cikin ka ya juye. But akwai secondary dysmenorrhea kuma da wannan ciwon nan nawa kake jiwo, amma akwai wani ciwo daban da ke jikin mace da ke cause wannan abu. Isa ba ciwon hailan nan duka ne normal ba. Isa tun cikin research mu ya gwada mana kamar inda hailan ki ya fara kina jin pain after kwana daya ya ke yana iya bata aikin ka, baka yi ka duba gida, baka yi ka yi komi, baka yi sana'a, kuma bai kamata kowane mace ta yi wahala domin wannan abu ba. Isa inda ya zo yana kawo problem haka nan, sai ka je healthcare providers, akwai magunguna da